Good morning. We're waking up to discussions of mental health along with our specialty coffee. In a minute, I'm going to show you how you can order your specialty coffee along with 3 teas. Let's jump right into discussions of mental health. What is a mental disorder? Well, there have been many definitions, but to sum it all up, a mental disorder is a clinical important collection of symptoms. These can be behavioral or psychological that causes an individual distress, disability, increased risk of suffering, disability, death, or the loss of freedom. Clinically important can be thought of as significant. So, significantly, a person is distressed. Significantly, loss of freedom. Significantly, thinks of death. And significantly, loss of freedom. So, it's not just waking up one day or 2 days thinking, oh, I feel blue. No. Let's start with mood disorder. Mood disorder for 2 weeks. 2 weeks consistently. You have 5 of the 9 symptoms. Now, think of 2 weeks, 14 days. That's half a month. Of course, symptoms can last longer, but for 2 weeks, you have had low mood. For 2 weeks, loss of interest. What you're normally interested in, you're no longer. For 2 weeks, you have not eaten nearly enough or you've eaten way too much. 2 weeks, you haven't slept well or haven't slept at all. 2 weeks, psychomotor activity, you're either sped up or you're moving very slowly. For 2 weeks, you're feeling fatigue, loss of energy. 2 weeks, your self-worth is very low. You're suffering from low self-esteem. For 2 weeks, your concentration is totally off. You cannot concentrate on much of anything. For 2 weeks, you've also may have had thoughts of death. Now, any of these 9 symptoms, you've experienced at least 5 of them, maybe more, but at least 5 are present for 2 weeks consistently, nearly every day. That's considered a diagnosis for mood disorder. A mood disorder can be a major depressive disorder. It can be manic. Let's talk about manic. Manic is a person who is way, way, way over the top. For an example, I can say, I'm Beyonce today. By the way, I did wake up this way. Fabulous. Let's talk about mixed. Mixed is major depressive disorder and manic together. Hypomanic. Some people consider hypomanic not such a bad thing, but hypomania can turn into mania. And mania is when hospitalization is sometimes needed. Hypomania, hospitalization is most times not needed. So again, that's mood disorder, and we have defined mental disorder today. One therapy that's used for mood disorder is reality therapy. So when you're seeking out therapists, ask their type of therapy. Reality therapy is the therapist is there for you in the here and now. They've created a safe, secure, confidential environment for you, and they're also going to challenge you for change. Basically, the question for reality therapists is to get you to understand, is what your behavior now working for you? If not, let's devise a plan for change. Let's talk about specialty coffees. In no way am I saying drinking coffee will lessen or cure a mental disorder. I've combined 2 of my loves, the field of mental health, which I am trained, educated, and licensed in, along with the field of coffee. I've done research in coffee, and I have operated a coffee shop, so I combined the two. When you sign up for specialty coffee, you're going to get 2 4-ounce different coffees along with 3 teas to try for the month. If you like one and you really want to stick with that one, you may order that. So go to www.decaved, that's D as in David, A as in Apple, C as in cat, A as in Apple, V as in Victor, E as in Edward, D as in David.com. Decaved.com is where you will find how to order. Until next time, enjoy.